physical, physiological and psychological effects of sports massage.
Reasons for having a sports massage. The first is pre-event. Now this can either be directly before an event, so maybe 20 to 30 minutes before the event starts, or in the weeks or months leading up to an event. For example, if your client is training for a marathon, you may see them fortnightly or even weekly before they begin their race. In terms of pre-event massage, there isn't a great deal amount of research behind the benefits of this technique. What we do know is we want to support and enhance a warm-up for the clients, but not to replace a warm-up. So the pre-event massage needs to work alongside some really good warm-up and training strategies. Things we need to take into consideration as a massage therapist is the type of the event and the techniques that may be suitable. For example, if your client is going for a sprinting event or something that's quite quick, we want to use more stimulating massage techniques to help with that. So rather than doing the slow effleurage or petrissage, we may use a deplotement or a soft tissue release that may be slightly more suitable because there's more movement involved. Our aim is to help and not hinder our clients, and being mindful of creating tissue damage and post-massage pain is key. As many of us are aware from having massage, sometimes clients may feel tense the next day, maybe feel a bit stiff, or their range of movement is decreased slightly. And we do not want to create this tissue damage before an event. So it's really important that we look after our clients and we use the right techniques to get the right results. In terms of post-event massage, this can help in a few different ways. It supports heart rate regulation, so it calms the heart rate down after exercise. It helps decrease pain, which we will discuss later on in some of the slides. And what it does do as well is it elicits a parasympathetic nervous response, which helps the body repair after an event. It's a really good thing to do after. In terms of delayed onset muscle soreness, which is the post-exercise muscle pain, there isn't that much research about how massage can help, but we will discuss this later in the soft tissue injury and dysfunction module. Injury prevention. Many people use massage as a preventative. The research that shows the effect of massage can have on pain, on the range of movement, maybe some of the reasons why it's a popular technique to help prevent people with injuries, either going into event or post-event. Some massage techniques can also increase proprioceptive feedback to help the client understand where they stand and move, which with improved proprioception may reduce injuries that are caused by overuse and dysfunction. So if your client has more aware of where their body is in space, the less likely they are to get injuries from restriction and tightness. Proprioception is the body's GPS system, which is the body's ability to understand where joints are in space by the nerve receptors in your muscles, tendons and ligaments. So some of our massage techniques that can help improve the range of movement at a joint, such as muscle energy technique or soft tissue release, will help improve that proprioception. And then coupled with some good homework strategies is a really good way of helping that client prevent injuries from posture, overuse and dysfunction. Tension and pain. This is a really common reason for the clients that aren't as active or more sedentary. Tension may be felt or experienced as a decrease in range of movement, guarding or protection of the muscle tissue. Massage stimulates the different nerve endings in these tissues, which are called mechanoreceptors. And the mechanoreceptors, they respond to changes in movement, texture and heat, which massage can do all three. By stimulating these mechanoreceptors, increases the amount of sensory input, so that increases the amount of feedback that gets sent to the central nervous system, so to the brain. And this increase of sensory input and feedback dampens down or overrides the pain signals. So it dampens down the nociceptors, which are the pain receptors, so less pain is felt. As discussed in the nervous system module, pain varies in person to person, but this feeling of nociceptive pain in the muscle tissue is a reason why clients choose to book a massage. And if massage helps override this by increasing the amount of sensory input, the client will feel less pain and then want to continue with having massage. Increasing range of movement within massage comes from the effect that it has on the muscles and all the tissues. There has been some studies that have been carried out demonstrating this, and even though muscle fibres cannot physically change length, it is the change in the contractile elements that creates the relaxation, which creates the increase of range of movement. For example, as massage is applied, we know it stimulates the mechanoreceptors, which by increasing that sensory feedback sends messages to the central nervous system, which one can decrease the feeling of pain, but two can have the effect of the contractile elements to relax, let go, and therefore achieves the increase of range of movement. The next is the recovery process, and this goes alongside with the post-event massage. So the perception of recovery may be increased with the increased parasympathetic nervous system activity. So if your client is feeling calmer and more relaxed in a massage, that perception of recovery may be because of that activity in the nervous system that is happening. There isn't that much research about the recovery process, but one study by Poppendick and others found that some short-term massage sessions, which were under 12 minutes long, that were conducted after exercise, provided a short-term recovery response to athletes when they were taking part in mixed intensity sport. So they did find there was some benefits in the short-term recovery from having a short massage at under 12 minutes long. Improving sleep. Field and others proposed a model where massage therapy increases the level of the neurotransmitters serotonin and dopamine, which are chemicals that both play a big part in sleep but also relaxation. In terms of heart rate regulation, initially we thought that massage increased circulation, and many studies now have shown that this is not the case. Circulation increases with the body based on the required demands of the body, so the more that you move, the more that your circulation increases. In massage, clients may be quite passive if they're in a position such as lying or seated. So the metabolic demands of the body are a lot lower than when a client is moving, which demonstrates that there might be a change in terms of heart rate regulation because the demands of the body are less, but also from a parasympathetic nervous system response, that also regulates the heart rate. So massage, by affecting the nervous system, can also affect the heart rate. The next is reducing in blood pressure. There was a study conducted in 2000 about the improvements on diastolic blood pressure with clients and adults diagnosed with high blood pressure. They also reported positive effects on anxiety and depression at the same time, which may have also had an effect on the diastolic blood pressure. The reduction of pain. And as mentioned before, this is one of the most popular reasons for having a massage. In terms of the science behind pain reduction, the research is limited. Some of the strongest research about massage therapy and pain reduction is around back pain, which we'll discuss in the soft tissue dysfunction and injury module. We've already mentioned that by having massage can stimulate the mechanoreceptors, which can override the nociceptors, so the pain response. But one thing to take away from this module is that pain is a response from the brain that the body is in danger. So massage can help calm the nervous system, which may be one of the reasons why the pain sensation is reduced, but also it could be that the nociceptors have been overridden by new sensory feedback coming in. And as mentioned before, we have a whole module on pain because it's a big topic to add in rather than just having one slide. The pressure applied in a sports massage. Some clients may experience post-massage soreness and malaise after a massage. Happens quite commonly in new clients, and it does vary from client to client. Researchers found that the deeper massage strokes tend to cause more of this malaise than the lighter strokes, and it varies from client to client. Some symptoms may be flu-like symptoms, and others may be muscle ache, stiffness, soreness after the massage. As we know, massage may cause some level of damage to the tissues, and some research says that it could be a similar response to delayed onset muscle soreness or something called a mild rhabdomyolysis. Rhabdomyolysis is damage to the sarcolemma of the muscle, and it often occurs with extra pressure or an increase in pressure on that tissue, which causes the sarcolemma to damage and then proteins leak out of the muscle tissue. Severe rhabdomyolysis is where bone or muscle crushing injuries have occurred, so maybe a car accident or a trauma like that. As a massage therapist, we want to be really mindful that we're not creating too much pressure on the client's muscle tissue and connective tissues. We know each client is different, and their perception of what massage feels like and what pain feels like is completely different. And we want to always err on the side of caution. We check in with our clients regularly during the massage and find out how it's feeling. Look for those signs and symptoms that you see. If it's a bit too painful, the client's ears might start to go red, they might wiggle their fingers or toes, or even hold their breath. And those are signs that their body feels like it's in danger. And then danger stimulates the sympathetic nervous system response, so the client becomes in a stressful scenario, which is not the goal of a massage. Our goal is not to damage tissue, but to help improve range of movement and improve tone of the tissue. The psychological effects of sports massage. The psychological effects of massage therapy. A study carried out by Moyer had found that massage therapy had had sizable reductions on feelings of depression and also significantly reduced anxiety in adults. They aren't 100% sure why this happened. One study did suggest that it had an effect on the neurotransmitters dopamine and serotonin. It's also been frequently reported that massage therapy can shift the balance in the autonomic nervous system. So the autonomic nervous system is made up of the two systems, the sympathetic nervous system and the parasympathetic nervous system. So massage helps reduce sympathetic nervous system activity, which then promotes the parasympathetic nervous system activity. The findings that Moyer and others had may have been from the promotion of relaxation and the improved sense of well-being that massage can create, a decrease in cardiovascular activity or decrease in muscle tone, and both of those are symptoms of anxiety. Some studies had initially found that massage also directly decreases the amount of cortisol, but other studies have found that this is too difficult to prove, as it's the changes of cortisol levels over time that makes a difference, not just after an initial activity. So what does this mean for massage? Well, we do know that massage improves the sense of well-being for the client. So along with improving the client's posture, decreasing muscle tone, and all that musculoskeletal effect that we can have, we can also positively affect their own well-being. So remember, homework that you give your client doesn't have to be exercises or stretches, but you can also recommend things such as meditation or mindfulness, or exercise such as yoga, which also reduces that sympathetic nervous system activity if you find that your client is stressed or has expressed feelings of stress. The final section of this presentation is a physiology of sports massage techniques. The first one we're going to discuss is compression. Compression technique is a technique that warms up the tissues. It's used as a palpation tool, so you can use it over clothes or through towels to see what's going on in the tissues. It also helps relax the client and helps the client prepare for the massage ahead. The normal contraindications and cautions do apply, but you want to avoid direct pressure on the bones and joints. Effleurage. This comes from the French word effleurer, which means to glide or touch lightly. It's a smooth massage stroke that decreases the sympathetic nervous system activity. So it's a really good technique to start to use at the beginning of your massage after your compression, as it spreads the medium, it introduces the therapist to your touch, and it's a really good connecting stroke when you integrate other massage strokes into your treatment. It also helps warm up the tissue and increases the local circulation. And for effleurage, the normal contraindications and cautions apply. Vibration. Vibration is a technique where the tissues are pressed down and released in up and down movement, so it increases temperature and local circulation. And for vibration, normal contraindications and cautions apply. Muscle energy technique. Muscle energy techniques is a broad name given to a number of techniques that target the nervous system to reduce resting tone within a muscle. It can be applied before, during, or after a treatment, and in a non-therapeutic environment such as the gym floor. The benefits are it increases range of movement at a joint and decreases tone in a muscle. In terms of contraindications and cautions, the normal contraindications apply to muscle energy technique, but you also want to be mindful that there is no pain present during the technique, either in the isometric contraction or in the stretch. Soft tissue release. Soft tissue release is a technique that helps mobilize soft tissues by localizing a stretch, by creating a lock, and which creates a false insertion point, which then you stretch away from. The benefits of soft tissue release are increased range of movement, reduction in pain, improves proprioception, and increases localized circulation. In terms of the contraindications and cautions, the normal contraindications and cautions apply. Friction. Friction is a non-gliding technique that involves repetition of movements transversely across the tissue. It can be used really well for areas such as tendons, ligaments, and muscle attachments close to the tendon attachment sites. Some of the benefits are it provides pain relief and has an analgesic effect for up to 24 hours. It can stimulate fibre regeneration. So there's some research on the benefits of scar tissue remodeling by using the friction massage technique. And it also increases blood flow through vasodilation, so local circulation. In terms of contraindications and cautions, the normal contraindications apply, but you also want to be mindful about not using this technique near joints with rheumatoid arthritis and with clients that are on anti-inflammatories. And finally, some recommended reading and resources based on sports massage physiology. Thank you for listening to the presentation and the online learning of sports massage physiology, and make sure you complete your workbook, which is assessment element number 6.